Great. This morning I was asked to talk a little bit about the first line of defense with Fusion Medical Pain Creams. First, I'd like to talk a little bit about the history or the background of the medication and what kind of pathologies it addresses. Secondly, I'd like to talk a little bit about the contents of this medicine. And then third, how you should target your customers and then further penetrate those accounts. Well, first of all, it's a non-steroidal anti-inflammatory drug. In short, it's an NSAID, and basically it's used to treat mild to moderate musculoskeletal pain in such pathologies as osteoarthritis, tendonitis, plantar fasciitis, and other tendon issues. A little bit about the contents of this medicine. There's four main contents. Number one, the active ingredient is diclofenac. That's the NSAID. It is used to reduce spelling. That won't help me with that. But it's used to reduce swelling as well as treat mild pain. And the second one is baclofen. Baclofen is I'm falling apart here.
It's okay.
Is
relax.
Antispasmodic, and it works especially well with NSAIDs. Third is cyclobenzaprine. Cyclobenzaprine is a muscle relaxer, and it's used to address the stiffness within the inflicted area. Third is tetracaine. Tetracaine, most likely by the suffix, is numbing. It's a local anesthetic. Third and finally, I'd like to talk a little bit about how you should penetrate and then grow your business within the accounts. I know in my situation, about 90% of my business, everybody I talk to is using Voltaren. That's a great entryway. The first pain cream is a direct way to combat that Voltaren for two reasons. Number one, the active ingredient in both medicines is diclofenac. In our case, we have 3 times the amount of diclofenac as does Voltaren. So a simple question can be posed to your surgeons, and there's a yes or a no answer. Doc, does Voltaren work for you? Yes, great. Well, we have 3 times the amount of diclofenac. Don't you think that this will work better for your patient? If the answer is no, well, geez, give us your next 10 patients. We have 3 times the amount of diclofenac, which is the active ingredient. Let me try your next 10 patients and see if this works for your patients. They can only be happy. Secondly is the RX process. Chatter on the street is that the RX process is a little different. For Voltaren, it's a little harder to get approved. Well, ours is a simple RX form, and I probably should have brought one to show you guys. But you fill out the RX form, send in with the fax in with the patient demographics. Our pharmacy will take care of all the rest of the burden for your office. We'll take care of the background of medications, as well as take care of the copay, as well as ship the medicine directly to your house. Third and finally, once you get in the account with this medicine, we offer 6 more medicines that cover moderate to severe neuropathic as well as musculoskeletal pain. And it's an easy way just to add some revenue into your accounts. I talked a little bit about the background of the medicine, the contents of the medicine, as well as how you can penetrate and grow your accounts. Does anybody have any questions?
That's great. Thanks, Matt.